Hpa Lanolin Ointment is used as a moisturizer to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations, such as diaper rash and skin burns from radiation therapy. It contains emollients that soften and moisturize the skin, as well as decrease itching and flaking. This ointment forms an oily layer on the top of the skin that traps water in the skin, helping to combat dry skin caused by a loss of water in the upper layer of the skin. It also includes humectants like glycerin, lecithin, and propylene glycol, which draw water into the outer layer of the skin. Additionally, it contains ingredients that soften the substance that holds the top layer of skin cells together, helping the dead skin cells fall off, retain more water, and leave the skin feeling smoother and softer. It is recommended for daily use and can be applied at any time of the day when needed. Make sure to use this Hpa Lanolin ointment as directed. Some products may need to be shaken before use, so be sure to check the label. You can apply it to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. For dry hands, you may need to use it every time you wash your hands. If you're using this ointment for diaper rash, be sure to clean the diaper area well before applying the product. And if you're using it for radiation skin burns, check with radiation personnel before applying it. Apply the ointment only to the skin, and avoid sensitive areas like your eyes, mouth, and groin area, unless directed otherwise. Remember to apply it regularly to get the most benefit, especially after bathing when the skin is still damp. And if your condition lasts or gets worse, seek medical help immediately. Using Hpa Lanolin ointment is generally safe and effective, with most people experiencing no side effects. However, some may experience burning, stinging, redness, or irritation. If these effects persist or worsen, it's important to inform your doctor or pharmacist. If your doctor has prescribed this medication, it means they have determined that the benefits outweigh the potential risks. Most people using this ointment do not experience serious side effects. Be sure to contact your doctor immediately if you notice any unusual changes in your skin, such as becoming white, soft, or soggy from excessive moisture, or if you notice signs of a skin infection. While it's rare, a serious allergic reaction to this ointment may occur. Seek medical help if you experience symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to consult your doctor or pharmacist. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Hpa Lanolin ointment, make sure to inform your healthcare provider if you have any allergies or skin cuts/infections/sores. Some ingredients in the ointment may make your skin more sensitive to the sun, so be sure to check the label for any warnings and take necessary precautions to protect your skin from the sun. If you have acne-prone skin, look for the word non-comedogenic on the label to avoid worsening acne. Additionally, some products may stain or discolor clothing, so it's important to be mindful of this. If you are pregnant or breastfeeding, consult your doctor before using this product. And before undergoing surgery, be sure to inform your healthcare provider about all the products you are using. When using Hpa Lanolin ointment, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk for serious side effects. To ensure safety, keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If this ointment is accidentally ingested, it can be harmful. In case of an overdose resulting in serious symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Hpa Lanolin ointment is typically used to treat dry, cracked, or sore nipples caused by breastfeeding. It can also be used to help with other minor skin irritations. The daily dosage and optimal timing for using this ointment should be followed according to the guidance of a healthcare professional. When it comes to preventing dry skin, there are a few things you can do. First, try using lukewarm water instead of hot water when bathing, and consider taking baths or showers less frequently, like every 1 to 2 days. Keep your baths or showers short, and if the air in your home is very dry, using a humidifier can help. There are different types of emollient products available, such as oils, creams, lotions, or sprays. Some may contain fragrances or other ingredients that could cause sensitivity in some people. It's important to consult with your doctor or pharmacist to find the best product for you. If you forget to use Hpa Lanolin Ointment on your regular schedule, use it as soon as you remember. Do not use extra ointment or apply it more frequently to make up for the missed dose. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep all medications away from children and pets. Avoid storing the foam canister near high heat or open flame, and do not puncture or burn the canister due to pressure. Do not dispose of medications in the toilet or drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.